My name is Professor Ian Chappell. I am the Director of Research for the Institute of Clinical Sciences, College of Medical and Dental Sciences at the University of Birmingham in the United Kingdom. And I'm Honorary Consultant with Birmingham Community Healthcare Trust in restorative dentistry, but my specialty really is periodontology, which is looking after and managing gum diseases. In terms of linking gum health to systemic health, the strongest evidence really is there for diabetes and for cardiovascular disease, and in that order. With diabetes, for example, what we find is that people who have severe gum disease, we call that severe periodontitis, they have higher levels of glucose, of sugar, in their bloodstream compared to those who don't have periodontitis. And actually, even if you don't have diabetes, you still have higher levels of glucose in your bloodstream if you have periodontitis than if you don't have periodontitis. And it's not the diabetic condition per se, it's those high levels of glucose that cause the complications of diabetes. And we call those macrovascular complications. They're the complications that can affect the kidneys and the heart. And then microvascular complications, they're the ones that can affect the small vessels, such as in the eye, and cause what is referred to as diabetic retinopathy. And so because of these complications, it's important that we look after our gums and we look after gum disease and treat it. So in terms of systemic and gum health links that aren't widely known to people, apart from obviously the key ones like diabetes and cardiovascular disease, there's quite an evidence base for periodontitis being associated with rheumatoid arthritis, and actually emerging evidence that if you treat the periodontitis to a healthy endpoint, the symptoms of the rheumatoid arthritis can improve. There are also strong associations emerging with chronic kidney disease, and certainly work from our own group has demonstrated that the association between periodontitis and chronic kidney disease is causal in nature. In other words, the periodontitis might be a component cause of the kidney failure in some people. There's also evidence emerging, and a body of evidence growing in recent years, for cognitive decline and neurodegenerative diseases, so conditions, for example, such as Alzheimer's disease, because we know that some of the bacteria that cause periodontitis can cross the blood-brain barrier, and they seem to induce inflammation in the brain. We also have evidence emerging for strong associations between periodontitis and inflammatory bowel diseases, conditions like Crohn's disease and ulcerative colitis, and also for associations between periodontitis and respiratory diseases, particularly inflammatory respiratory diseases such as COPD, which is chronic obstructive pulmonary disease. And obviously COVID lung disease has emerged in the last few years during the pandemic as something that is also strongly associated with periodontitis. So why did I start to collaborate with Dr. Lloyd-Jones? Quite simply, he phoned me up on a Sunday afternoon, and we had a long chat, 2 hours, something like that, in the garden. Graham's an anatomist, so radiologists have a very, very intensely detailed knowledge of human anatomy, because that's what they need to interpret X-rays. And Graham was struck by what he was seeing in the lungs of people with COVID lung disease. Because what he was seeing wasn't a lung disease that was typical of a respiratory pneumonia. It was at the sides and the back of the lungs where the congestion and the inflammation was, rather than down the upper airway and in the middle.
Hello, I'm Dr. Graham Lloyd-Jones. I'm a consultant radiologist in Salisbury, UK, and Director of Radiology Masterclass. I was researching the medical imaging of COVID-19 and trying to explain the vascular characteristics of the disease that we see in the lungs on chest X-rays and CT scans. And I think that understanding how gum disease is associated with severe COVID could help us explain the many links there are now established between gum disease and developing important diseases of the body. On CT scans of patients with COVID-19, we see a vascular distribution of disease affecting the bottom and the back and the sides of the lungs, and it's the blood vessels which are abnormal rather than the airways. And in trying to explain that, I wondered if the virus could be arriving in the lungs directly via the bloodstream. Thinking back to how the virus gets into the body, we know it affects the upper respiratory tract and the mouth, where it replicates, it copies itself in the mouth, to a point where a single teaspoon of saliva can contain up to 500 million copies of the virus. And I wondered, could the virus be leaking out of our mouths and passing straight into the bloodstream? And if so, it would pass through the chest, into the heart, and into the bottom of the lungs, exactly to where we see those areas of lung damage with clotted lungs and abnormal blood vessels in COVID-19.
Oral health and systemic diseases, in terms of how it may help people's well-being and mental health, I'm not sure that it's widely known, but there was a study in 2017 called the Global Burden of Disease Study, published in The Lancet, and it looked at something like 364 human diseases and conditions, and showed that periodontitis, along with dental caries, so they're the major two oral diseases, those oral diseases were responsible for more years lost to disability than any other of those 364 human conditions. It's probably also not widely known, but certainly in the UK it's the case, that 1 in 5 emergency admissions to hospital of children are due to dental abscesses and complications, if you like, of tooth decay. The impact is huge on the economy. Back in 2015 it was around $550 billion, and about $80 billion was periodontitis related. And there's also a human cost, and that human cost includes ability to eat, ability to speak, effects on people's appearance, and as a result of that, their self-confidence and well-being and quality of life. These are all really, really important issues. And you might ask yourself the question, well, why is that? And the reason's quite straightforward. If you think about the skin is designed to protect the internal structures of our body. And when bacteria build up on our skin, as they do on a daily basis, the skin will eventually shed those bacteria as the skin drops off. But the teeth don't shed. The enamel of your tooth is a non-shedding surface, and so the bacteria build up. We call that dental plaque biofilm. So unless you brush it off on a regular basis, it just builds and builds and builds. And ultimately, those bacteria cause inflammation in the gums. The gums then ulcerate, and that ulcer is between the gum and the tooth. You can't actually see it, but it's like a revolving door. And every time you eat and brush your teeth and speak, those bacteria get pushed into the bloodstream, and they travel to other parts of the body where they can actually cause problems, infection and inflammation.
As soon as we consider that there could be a direct anatomical link between the mouth and the rest of the body via the blood, it's easy to speculate that gum disease and poor oral health could be linked with many diseases of the body. The good news is that caring for our mouths is always going to be good for us. I think it's time for doctors to take gum disease seriously. There is a role for all doctors, especially those of us caring for patients with chronic diseases, to make sure that we provide them the best possible oral health care.
It's very interesting when you speak to family doctors, they're very clear that they get about 30 minutes, 45 minutes on the mouth as part of their undergraduate curriculum. And that's literally all they get. And they complain about this because clearly it's very difficult for them to engage, if you like, with subtle oral diseases. And so I always use the example of the door into your house. So the mouth is a window on the body. It's the entry point to the body, in a way, if you think about it. And the mouth is actually external to the body. It's covered by skin that protects the internal organs and structures of the body from the bacteria and the viruses and the fungi that are in our mouths. So if you imagine your doormat as you enter the house, if you don't clean that doormat on a relatively regular basis, the dirt builds up and eventually it treads into the house. And it's a little bit like that as the plaque builds up on the teeth. If it's not removed on a regular basis, those bacteria can get into the bloodstream, as can viruses, and they can cause all kinds of problems. So vital that other healthcare professionals, whether they be pharmacists, family doctors, general nurses, even community midwives, start to learn more about the mouth and about periodontal disease in particular, And we need to develop tools for them to be able to identify periodontal disease without actually having to physically examine the mouth, because that's a difficult thing to do when it comes to diagnosis.
I think that all doctors and medical students need to be taught the links between poor oral health and gum disease and development and worsening of many systemic diseases of the body. For too long, doctors have considered poor oral health and gum disease to be coincidental to poor overall general health. I think it's time to take gum disease seriously, and as my friend and colleague Professor Chappell says, it's time to put the mouth back into the body.